I'd like to continue with treatment for DID. Once again, I'll return to Go Mentor for their suggested treatment. There may not be a cure for dissociative identity disorder, but treatment including psychotherapy has been very helpful in the long run, dealing with these symptoms. NAMI also adds that treatment for DID consists primarily of psychotherapy with hypnosis. The therapist attempts to make contact with as many alters as possible and to understand their roles and functions in an individual's life. In particular, the therapist seeks to form an effective relationship with any personalities that are responsible for violent or self-destructive behavior and to curb this behavior. The therapist aims to establish communication among the personality states and to find ones that have memories of traumatic events in the individual's past. The goal of the therapist is to enable the individual to achieve breakdown in the patient's separate identities and unification into a single identity. Retrieving and dealing with memories of trauma is important for a person living with DID because this disorder is believed to be triggered by physical or sexual abuse in their childhood. Young children have a pronounced ability to dissociate, and it is believed that those who are abused may learn to dissociate as a defense. In effect, the child slips into a state of mind in which it seems the abuse is not really occurring to him or her, but to somebody else. In time, such a child may begin to emotionally and cognitively split into alternate identities. Research has shown that the average age of the initial development of alters is 5.9 years old. In individuals where dissociation is thought to be a symptom of another mental illness, such as borderline personality disorder, BDP, or post-traumatic stress disorder, PTSD, treatment of the primary cause is of the utmost importance. Children affected by DID may experience a variety of symptoms, including depressive tendencies, anxiety, conduct problems, episodes of amnesia, difficulty paying attention, anxiety, and schools and hallucinations. Often these children are misdiagnosed as having schizophrenia. By the time the child reaches adolescence, it is less likely for the mental health professional to recognize the symptoms and make a diagnosis of DID. Next, I'd like to offer more treatment information on DID from the Psych Central website. Psychotherapy approaches vary widely, but generally takes an individual modality as opposed to family, group, or couples therapy, and emphasize the integration of the various personality states into one cohesive whole personality. It should be noted that while it's convenient to talk of people who suffer from this disease as having multiple personalities, this is just a theoretical construct. People who suffer from this disorder believe they have multiple personalities, which then take on a life of their own within the individual, perhaps reinforced by the belief. The new term for this disorder is DSM-4. It more accurately reflects the problem the individual suffers from dissociative identities. The personality is the sum of these identities, which have been split off at some point in the past. The split is usually due to some individual or multiple traumatic events. The use of medication except for the treatment of acute, specific concurrent axis 1 disorders is not recommended. Maintenance and effective use of prescriptions given the multiple personality state is difficult to attain. If medication is prescribed, it should be carefully monitored. In a growing trend, people with disorder are starting to come together to form mutual help support groups within the larger communities and virtually through online communities. There is no overt reason why a support group for this disorder would not be beneficial to individuals. I'd like to return to NAMI as they provide what a friend or family member can do to help someone living with DID. Be informed, learn all you can about DID. If your friend or loved one living with DID switches to another alter, they may sound and act differently, and this change can be abrupt. They may not know who you are. Introduce yourself if they don't know you, or offer reassurance if they are frightened. Be aware of signs that your loved one might be at risk for suicide, as this is not common for someone affected by DID. If you think they may be at risk for harming themselves, call the suicide hotline at 273-TALK. Get the professional help as soon as possible, or take them to the nearest emergency room. Be willing to listen. Simply listen if your loved one wants to talk. Listening without interruption and without judging when your friend or loved one wants to talk is extremely helpful. You don't need to try to solve their problems, just listen.